Hi, I'm Urajnik, the Director of the Center for Rural and Northern Health Research, or CRANER as we affectionately call it, and I'd like to thank the conference organizers for this invitation to speak. It's an honor to give this talk today at this inaugural event to celebrate the accomplishments of researchers and students at Algoma University and other stakeholders across the North as we work towards a healthier future. So thank you for making the time to listen to my talk today, entitled Applied Health Research Within a Northern Context, Engagement and Innovation. And before I start, I'd like to acknowledge that I'm a settler on the traditional lands of the Atikameksheng and Anishinaabeg, and I acknowledge and respect this. And also before I start, I'd like to acknowledge that we're a fully grant-funded health research center with funds directed solely towards the operations of the center and our activities to this end. I'd also like to acknowledge that I have multiple roles, one of which is my role at the Northern Ontario School of Medicine as co-chair of the Social and Population Health theme in the undergraduate medical education program, and my affiliations with the schools of Rural and Northern Health, Human Sciences and Kinesiology, and Department of Psychology at Laurentian University. Although my primary appointment is with CRANER and monies received as grants are directed through the center. So I'm going to start with an overview of the center. As I mentioned, CRANER is a fully grant-funded health research center, and I'm going to talk about some key research themes and some of the activities within those on the journey to who we are today. So what we do is CRANER, but also what we offer in terms of our expertise in northern and rural health. And then I'm going to talk about how we've pivoted to address the COVID-19 pandemic. I think we've all had to innovate given our realities and what that means as we conduct research in this new environment. And then I'll speak to where we're headed with some key highlights from our patient and community engagement portfolio and some innovative opportunities before moving into some concluding comments. So we're an academic and applied health research center located on the Laurentian University campus, although there is a CRANER West, which is located at Lakehead University. And we've engaged in collaborative work over the years, although our centers are separate entities. But consistent with our mandate, we conduct northern and rural health research to improve health services and access to healthcare with an equity lens. Equity is a large focus for us. And we examine the impacts on health outcomes for people in northern, rural, and remote Ontario. We take an interdisciplinary and multi-method approach to what we do that involves and integrates the perspectives of Northern Ontarians, including Indigenous and Francophone peoples, visible minorities, immigrants and newcomers, and other stakeholders such as healthcare providers, planners, and decision makers. Our goal is to more fully understand and promote understanding of health needs, access to quality health care, and service or program impacts for the populations that we serve in our region for positive change, or like I said, for improved health. And so the dissemination and use of our research findings are also very important to this end. We're also a part of Canada's strategy for patient-oriented research, known as SPORE. And so, excuse me, we're one of 15 Ontario SPORE support units under the auspices of the Ontario SPORE Support Unit, or OSU. We're the northern partner under the Provincial SPORE Initiative with a mandate for patient and community engagement and capacity building from a northern and rural perspective. And for over 25 years now, we've provided research infrastructure and expertise in several key areas, including expertise in Francophone and Indigenous health, currently provided by CRANER executive committee members and faculty affiliated investigators. We have over 30 affiliated investigators from various schools and departments at Laurentian, NOSM, and also from external national and international academic institutions. We've also employed upwards of 15 full-time staff at any given time who have supported our research activities within 4 to 5 areas or programs of research, or arms of research, I like to call them, which are in Francophone Health, Indigenous Health, Health Human Services, the NOSM Integrated Impact Program, and virtual care research. And you'll see here at the right of the slide, we are situated within a SPORE framework, which means really that we've integrated an engagement lens across these areas of research, one of responsiveness to our community partners, and one that's inclusive of rural, Indigenous, and Francophone populations. And we apply an IKT approach to our activities where patients, communities, providers, and decision makers and other stakeholders are active contributors in all aspects of our research. And so we collaborate closely with stakeholders to ensure that our work is applicable to organizations and communities across the North. And I'll mention some of the highlights of some of the work that we've done within most of these areas in the chart here. And then I'll speak to our SPORE framework and core functions as a SPORE center, because this really drives what we do. So for our Francophone program, Crainer's been working on a number of projects concerning Franco-Ontarian health, as well as the health of French-speaking immigrants and newcomers in the North. And you can see some of our collaborators here at the bottom of the slide. We know of the importance of culture and communication in the delivery of healthcare, and the largest representation of Francophones in Canada are in Ontario, outside of Quebec. But Francophones face linguistic and cultural barriers because of their minority status in the province, such as language discordance and the experience of care delivery, and this can impact their health status. And Francophones in Northern Ontario experience poorer health outcomes than the general population, which really emphasizes the need to better understand how we provide healthcare to Francophones, as well as the communication challenges between patients and family physicians in the region. So Crainer researchers have been examining such things as access to French language services in the primary healthcare sector and the quality of these services, active offer of French language services, which is an open invitation to use one or the other of our official languages in the receipt of services, English or French. And also Francophone immigrant and newcomer health is another project area or focus. With some of the work noted here, work coming out of this, noted here on the slide, around Francophone patient experiences during interactions with their family physicians in Northern Ontario, which looked at language concordance between patients and physicians. You'll also see here, we've looked at the experiences or perspectives of family physicians in the Northeast around barriers to offering health services to French-speaking patients, and strategies such as being sensitive to the linguistic needs of patients to address challenges. And the findings of this work in particular, that there's challenges or gaps in French language services, healthcare services in Northern Ontario. This has led to a partnership between Crainer and NOSM to offer a continuing education program for family physicians, which focuses on the communication needs of Northern Ontarian Francophones. And this is called Ici on Parle. So the findings coming out of our program of research on Francophone health have really emphasized that we need to better understand aspects of French language health services that might impact care. And because of this, what we're finding has informed training programs to this end. Consistent with our focus on health equity and strong partnerships, we also have a history of dedication to Indigenous health. And the foundation of this commitment has been our community-based participatory work with Indigenous communities. For example, Craner has supported work with Indigenous nations across Ontario and Canada, and has developed particularly strong relationships with the First Nations of the Manitoulin Island area. With some of our activities in the past having focused on the development of community-based diabetes care strategies, a focus on the health and well-being of older adults, including improved quality of life with Indigenous people living with dementia and their families, and cultural safety training, design, and evaluation. And more recently, support of Indigenous governed administrative health data activities, which I'll speak a bit more about later. And we also have a growing focus on providing support for program evaluations. And I have here at the bottom of the slide a listed example of our involvement in the Nanduwe Nujamawin program evaluation offered by Mamoudzene North Shore Community Health Services, an organization that serves 7 First Nations communities across Lake Huron. And the program is a 5-day residential retreat designed to provide holistic healing approaches to people affected by childhood trauma and to support them through their healing journey. And Craner was invited to partner to document the program implementation process and to evaluate its outcomes. And so we worked really closely with program staff and participants on an evaluation that will allow them to better understand the immediate impact of the program and to plan for future offerings of it, including the potential for it to grow within other First Nations communities who are working towards their individual and community healing journeys. So in our support, it's really critical to promote the health and wellness of Indigenous peoples because of the legacy of colonialism. And healing requires Indigenous-led program development and implementation and evaluation. And the evaluation has continued to have positive impact. It's led to strengthened relations between Craner and Mamoudzene and further collaborative work to adopt the forms and the survey used in the evaluation to an online format because of our COVID reality. And it's also led to the development of other partnerships for us at Craner to support evaluation activities and capacity development. Our center also has a strong history of collaboration and exploration surrounding health human services in northern, rural, and remote regions, which might be best exemplified by Craner's tracking study on NOSM students, which has evolved into a series of studies examining the medical education pathway of learners, starting with the admissions process and continuing through the undergraduate and postgraduate medical education programs and into clinical practice. Excuse me. And this has been one of the few studies to track learners to understand where and how they practice, with the tracking of things like choice of medical discipline or specialty, practice location, and other practice characteristics throughout their medical career. And the overarching goal of this research was to look more carefully and deeply at the impact that NOSM programs, people, learners, and graduates have on the social, economic, and population health of Northern Ontario. And you'll also see further down here, this work has led to Craner's participation internationally in an international research consortium coordinated by the Training for Health Equity Network, or the NET, which is a collective of 13 medical schools that have social accountability mandates. And Craner conducted surveys of NOSM medical learners as part of this, of the graduate outcome study. We've also had the opportunity to work with colleagues from Norway and NOSM to set up an evaluation of the Finnmark medical education program. And Finnmark is a county in northern Norway that's sparsely populated and medically underserved. So similar in many respects to what we may experience in the north. And the Arctic University of Norway has expanded its distributed medical education program in Finnmark County and has partnered with NOSM and Craner to evaluate program implementation and outcomes. So Craner's helped establish and has been involved with this work from the beginning. And In late 2019, we've helped transfer responsibility of the tracking study and the graduate outcome study to NOSM, so the work will be ongoing. Our research into health human resources has continued as well, as illustrated by a current study that's looking to develop working models for human capital planning in Northern Ontario, with a focus on the primary care workforce, which we're doing in collaboration with the medical school, with NOSM, and in conjunction with knowledge experts from across Northeastern and Northwestern Ontario. And more specifically, the study is working towards the development of a mathematical model that will estimate community-specific need for primary care services in communities, with really very real-world applicability of the findings to communities and provincial ministries and other stakeholders like workforce planning boards to help organize the delivery of primary care services, as well as provide information that could inform recruitment and retention of the primary healthcare workforce. So moving into our work as the Northern Sports Centre in Ontario, there's much of the work that I've described thus far that can be considered separate from our mandate as a sports centre, although we do operate within the framework of sport. So we are a sport support research centre since 2016, and one of such centres, excuse me, or entities in the province that fall under the auspices, as I'd mentioned previously, of the Ontario Sports Support Unit, or OSU. And so OSU is the coordinating center that facilitates and integrates activities across the network of centers to implement Canada's strategy for patient-oriented research in Ontario. And this is jointly funded by the Ontario government and CIHR. So to support patient-oriented research in the province as part of the overall Canadian strategy, with the goal of supporting SPOR stakeholders in building capacity in and in doing more, with consumer and community engagement as the foundation of everything that we do in terms of our activities. To make sure that research focuses on patient and community identified priorities to lead to improved health outcomes. With patient engagement in research, you'll see on this slide, being the meaningful and active collaboration of patients in areas of governance, priority setting, and in the conduct of research, including in the sharing and application of research findings. So meaningful collaboration in all of these areas, with keywords being engage, partners, we speak of patients as patient partners, and of course, patient identified priorities. I also should mention here that patient is an overarching term inclusive of people with personal experience of a health issue, but also those key people in the personal lives of patients that have experiences of the issue as well, such as informal caregivers and family members. And knowing that there isn't a term that fits everyone. And in the North, we more appropriately speak of patient as individual or community or groups that represent people who are directly affected by a health-related decision. So how do we conduct POR, or what do we do at Craner specifically within that overall framework? We work to address several core functions, and I'll mention about 3 or 4 of these functions with some examples to give you an idea of what we do and opportunities within these areas. With one core function being to provide or support to regional and local research needs. So for example, as the lead for POR involving Northern communities and priorities, we work quite closely with researchers based in other areas of the province to lend our expertise as a means of engaging the perspectives of the North for the populations that we serve. And an example here is that we provide support to our Southern partners for their SPOR-funded research projects done in the North. such as our involvement in the CAST, or Community Asset Supporting Transition Study, supported by an OSU Impact Award and led by colleagues at McMaster University in the School of Nursing. And this was a pragmatic, randomized controlled trial of a support intervention for older adults transitioning from hospital to home. And Sudbury was one of the 3 sites for study implementation, the other 2 being Hamilton and Burlington. But the intent was to evaluate the intervention for older adults with chronic conditions and depressive symptoms for patients that we recruited from Health Sciences North, to look at outcomes, other outcomes from the intervention as compared to usual care, and looking at a range of things, including mental health functioning of the patients and health-related quality of life, the use of health services, and patient and caregiver experiences also with the intervention. So the study captured, I mentioned this because the study captured patient experience as well, and we had done quite a bit of work around that. So this is an example of the work that we do to support SCORE-funded research and investigators, our colleagues and investigators in other areas. On a local level, we're responsive to and support community partners that have an interest in research or evaluation of local programs or activities to make sure that these are relevant or suiting the needs of our diverse northern populations, such as here, our partnership with the local Northern Initiative for Social Action, or NISA, to evaluate the regional warm line. And NISA is an organization run by and for consumers of mental health services. And the warm line is a peer-led non-crisis telephone support service that's meant to fill community needs by rounding out mental health services in the community. So callers incorporate the warm line as part of their recovery support system. And this particular evaluation was meant to explore which communities in the North are accessing the warm line and how we can enhance the service for our Northern populations, including older adults, Francophone, Indigenous, and LGBTQ2+ communities. And this was a mixed methods evaluation whereby we gathered call log data, such as geographic information from what geographic part of the province were people accessing the line from, calling in from, the number of calls coming in, the length of the calls, and we also gathered information on the qualitative experiences of staff and callers with the line. Really important here, and which is a core component of patient-oriented research, is we engage NISA members themselves upfront in the development of the measures and as members of an agency ethics review to provide input into the study and to shape it in the way that was relevant to them as service users. We also, as a core function, provide consultation and other research services. So at any given time, we're approached for our expertise in rural and northern health research around the engagement of northern perspectives and to provide services for stakeholders that are wanting to build capacity for POR. For example, we've developed and delivered a POR training workshop to the St. Joe's Care Group in Thunder Bay. And this was for a group interested in developing POR guidelines and a research proposal to study the engagements of substance-involved inpatients in health services. We're also approached by stakeholders such as the LHINs at any given time for consultation support and research services, in which may take the form of rapid reviews to support decision-making or the provision, and also we're called on for our expertise in ad hoc analytical data analysis in terms of consultation and support. We're also approached to provide our input on existing programs of research, or the development of resources is another example here, such as the provision of input for the POR Training and Learning Primary Healthcare, or Portal PHC, online training program, sponsored by the Center for Studies in Family Medicine, in the Schulich School of Medicine and Dentistry at Western. And we user tested the program and provided resources to meet the needs of Northern users of the program. So in short, we're available to provide support in offering a rural and Northern health lens and to support others in building in-house capacity actually as well. Excuse me. And here, so a lot of what we do is to support capacity building for groups or organizations. But part of that is also to support trainees, whether the next generation of Northern and rural health researchers or scientists or staff and early and mid-career researchers. By way of our collaborations with various centers, schools, and departments across the university community. We do things, of course, like mentor graduate and undergraduate research, but we also have a number of external collaborations with other organizations and academic institutions like U of T, UBC, or the University of British Columbia through our faculty affiliated investigators. We also host summer research interns and practicum students. And right now, actually, we have a nursing student on placement with us and involved in some of our Indigenous work with Mamosane. We also have a Craner faculty affiliated investigator, Jennifer Walker, who's a network mentor in the Indigenous Mentorship Network program that provides mentorship to Indigenous health scholars and trainees. And we're ramping up in terms of offering trainings and workshops. And I have here provincial POR training. We'll be doing a Northern training event sponsored by OSU based on the CMAJ supplement of the Ontario experience of engaging patients in health research, which was derailed actually because of COVID some months ago. But this training will be for graduate students and new investigators looking to learn more about POR and how to integrate it in the research and from a Northern perspective. And the last core function that I wanted to mention today is that we at Craner support SCORE's objectives of enhancing data platforms and services. Craner's been central in the development and inaugural governance structure of the ICES North site and supports other provincial efforts to enhance data platforms and services. For example, 2 Craner faculty affiliated investigators were founding members of the ICES North Steering Committee, Alain Gauthier and Jennifer Walker. And together with ongoing efforts to build shared Northern information technology, infrastructure to improve availability, the North site has enabled community access to provincial and regional de-identified data sets, allowing collaborations with First Nations, Francophone, and rural and remote communities to answer questions that are important to them. And Indigenous ICES partnerships have enabled Indigenous-driven analyses using ICES data. Craner investigators have also established a partnership with the Ontario Pharmacy Evidence Network, or OPEN, in collaboration with Nancy Waite, who is a co-director of OPEN and professor at the University of Waterloo, to look at the geographic distribution, and work patterns of French-speaking pharmacists in Ontario. And part of this is an examination of anonymized data from the College of Pharmacists of Ontario to better understand the contribution of pharmacists to primary healthcare in the province. So part of what we do at Craner is to promote capacity for data in the North, for data access and use to support and inform analyses and community-driven or patient-oriented research. So as a SPORE center, we do work to make sure that OSU objectives and activities and our core functions support POR and really are inclusive of Northern, rural, and remote populations. And what I've showed you is really more high level on what we offer. And those aren't our only core functions, but patient and community engagement broadly is the framework within which we operate at the center. And we work to make sure that we strive, to incorporate a northern and rural lens. But it's not without its challenges. Doing research in the North has challenges, excuse me, and some aren't unique, like dealing with multiple research ethics boards, which can be hard, it can be difficult and time consuming, especially when the lead investigators are from other jurisdictions or other parts of the province and elsewhere, yet implementing a northern component in their studies. But some issues are unique to the work we do in the North. The region is quite large, right, and heterogeneous, making it necessary to travel sometimes really long distances to reach patient and community partners, more so pre-COVID. But incorporating the voice of patients is a concern, right? It's trying to capture the voices that are representative of our huge territory, and its diversity is really complex. And so you can imagine difficult when it comes to meaningful engagement across our diverse and expansive region. And meaningful engagement takes time. In Indigenous work, building relationships and trust are imperative to working with communities. And the process doesn't follow a strict timeline that's set forth by, often by set forth by a CHR or a SHRC or an NSERC, right? So those wanting to engage with Indigenous communities need to be aware of this, and that this engagement process takes time and a commitment to working with the community to make sure that the project is driven by their needs and priorities. And then the pandemic hit us. The first wave hit, and the focus was on the front line and clinical services and supports, which has presented real challenges to patient and community engagement. And understandably so, right? With alarm over the absence of the patient and community voice in research and clinical decision-making, which has required us to innovate with flexibility by leveraging virtual technology, of course, we're all engaged in, but in also providing support as Craner to various initiatives and programs in the local health system around the pandemic, and also by pivoting within our current areas of research. Such as in our work with the OCP data in collaboration with Open, and you might find this interesting, so I mention it. Our Francophone Health researchers are exploring the distribution of pharmacists who are capable of administering injections in Ontario, and finding that rural communities are less likely to have an adequate access to injection-trained pharmacists or no access at all. And that health units serving larger catchment areas or land areas have more communities, of course, we're finding, with no injection capacity. So this particular study will inform the vaccine rollout in phase 2 of Ontario's vaccine distribution plan, when pharmacists will start to vaccinate the general public. And the vaccine distribution will be especially challenging, right, for northern public health units, given that they have smaller population densities, larger land areas, and fewer injection-trained pharmacists. So being in the North, we have some unique considerations around delivery issues across many small dispersed communities. And to this end, we're also supporting public health sub-region districts with epidemiological support and expertise to guide planning around local vaccination rollout, with particular attention to the development of a local data management infrastructure to inform the rollout. And in the area of virtual care, we've pivoted, quite a bit to work with, for example, to work with Mademoiselle to adapt their program, their Nandaway program for on-line delivery. And also interesting, we've partnered, we're doing other kinds of work in virtual care as well. We've partnered with a tech firm, MLD Solutions, to explore the use of one of their products. And I've realized here I don't specifically have that on the slide here, but their product called Mosaic Global for producing digital content in support of mental health with a focus on the mental health of children and families and their parents or caregivers. And the idea here is to digitize static mental health resources or to add interesting interactive elements to existing digital resources that would best meet their needs, such as resources geared towards stress, anxiety, parenting stress, given our realities of this post-COVID world, where we are working from home, engaging in online learning, all of those things at the same time, and what have you. And then we're seeking broader distribution of these resources to meet needs. So interesting times in innovations indeed. Where are we headed in this journey? We'll continue to work on adapting our patient and community engagement strategies for the diversity of Northern Ontario and expand our themes, our programs of research. But I'd like to mention two areas of focus as we move into our next phase of our SPOR portfolio, involving further capacity building. With the first focused on the development of an early career researcher community of practice. Capacity for POR requires that all stakeholders are trained and ready to work collaboratively on research that is patient and community driven, which includes training and providing support for early career researchers. And doing POR introduces unique considerations, right? When faced by an ECR, such as identifying, or for anybody for that matter, such as in identifying patient partners, securing and sustaining their meaningful engagement throughout the entire research cycle. But there's no forum for early career researchers doing POR or wanting to do POR to share their insights or knowledge, or to develop relationships, networks, and benefit from mentorship. So the development of a SPOR COP, or community of practice, will really address these unique challenges also experienced by ECRs and support career pathways by building knowledge and skills in POR to cultivate a community of POR researchers and position ECRs as they move throughout their careers. And Craner will be leading this work for the North alongside colleagues in children's health and aging, where we'll bring together ECRs to develop this group and scale it up provincially across the province and in alignment with the SPOR national training entity and for the SPOR capacity development initiative. So in alignment with those. Capacity for engaged and meaningful POR also requires a focused equity, diversity, and inclusion, or EDI lens for POR support. And OSU has developed significant capacity for Indigenous POR across Ontario. But as we move into the next phase of SPOR, into SPOR phase 2 is what it's called, or what we're calling it in Ontario. And along with support for First Nations-led POR, OSU will build on its Indigenous focus through implementing a Métis and Inuit Indigenous initiative and led by us here at Craner, which more broadly will support enhanced capacity for POR among Métis and Inuit stakeholders and communities and researchers, with some objectives focusing on identifying challenges and research priorities for Métis and Inuit community-led POR in Ontario, and supporting POR needs that are sensitive to equity in Métis and Inuit-led visions for knowledge co-creation and translation. And really, this initiative will seek to engage Métis and Inuit perspectives in OSU's governance structure as well, and support connections between Métis and Inuit stakeholders within OSU and in Métis and Inuit-led research and data management, and also trainees, as mentioned. So Craner will act as the coordinating point of contact for the initiative as we move into SPOR phase 2. Just for some concluding comments, we collectively undertake research and evaluation to improve the health and well-being of the people of Northern Ontario. And that means focusing on equity, focusing on meaningful engagement, and focusing on partnerships and also friendships as we move along on our journey as researchers, listening and watching and learning as much as we engage in the doing piece. And given our pandemic situation, we shift, we innovate, always moving to be flexible and responsive to our communities and collaborators. For Craner, or from Craner's perspective, our many partnerships and collaborations with stakeholders across Ontario has led to a greater awareness of Northern issues and an elevation of the importance of Indigenous and Francophone health research and the realities of living in the North, and also the importance of health human resources, planning in terms of health human resources within our region to meet the health and support needs of Northern populations. And I'll end with saying that collectively, as researchers, students, communities, families, individuals, I think we're making a huge impact, and we just have to keep moving forward on this journey, and this is good. Thank you. And please reach out to me. I'll end with that. And please reach out to me with any questions that you might have, even directly to me by way of my contact information here on the slide. And I'm happy to answer any questions as best I can. Thank you once again for this opportunity.